are cultural brokers. People have to understand and realise that we are the middle person to get the communication right. You have to have that cultural broker, language speaker, interpreter. That's the best way to work with a patient, because I know I work with a lot and it's good. I enjoy it, you know. I enjoy it.
In some places, the clinicians come in because they've got the background, they've got the technical skills, they think they know better, but then they forget about the community dynamics and what it means to have cultural issues that come into the health, which they never prepared themselves for that. And so this is why then you rely on your Aboriginal staff.
Just being a local person, an Indigenous person in the clinic, knowing there's a lot of clients, Indigenous clients coming through the door, just make them feel comfortable when they're coming, and knowing that there's somebody, their own country people that they can talk to in regards to anything. Maybe it's just a simple thing like, I'm here for this, who can I see? We're there to answer the questions.
I don't know, I think I have strong community connections here, and I think that's one of the things that makes people feel comfortable with me. And I don't know, I think I try to enter my consults with no judgment and just ensure that people know that I'm just there to help them, and that my personal opinion is left at the door, kind of thing.
My role is to advocate, promote health and well-being, physical health as well, clinical, acute care.
In remote areas in particular, Aboriginal health workers and practitioners are absolutely essential. They often have on-the-ground knowledge of the community and the community members. They may know people socially or be related to them. They're able to go back into the community and promote regular checkups, and also to find people who might have been lost to follow-up, so people with positive results who don't necessarily have an address or a regular phone number.
So their role in looking after the community around STIs and in health in general plays a big part, because of their knowledge and experience. And the more training that we can give them through our health service just broadens our horizon.
I guess Indigenous health workers in general are sort of the backbone of health services in Indigenous communities. It's the first person everyone runs to, when you're visiting the community, to ask questions around, who are the key players here, who can we liaise with, who do we seek approval for, what's the process of doing this, what's the process of doing that. They're much more than health workers.
It's a hard job, especially when you're seeing your nephew or your cousin or your uncle. Sometimes it might be even your father that you might have to chase up as a contact tracing, and sometimes it gets shamed in the community. Some people don't want to do it because of the hard questions.
Sometimes that family members come in, or friends, when they come in, when they see me and know that I'm here, that I'm working here, but when they actually see me, they're trying to dodge me. But it's just because I work in this area, I don't take it personally. I just put my professional hat on and trying to sidetrack their whatever's going on.
But if it's my auntie when I'm doing her work, I'll just tell the doctor, no, I can't say that. So I've got to get somebody else to sit in with me and interpret or talk about auntie or talk about daughter-in-law. It's when it gets very cultural, it's very cultural thing it is. You can't talk about your sister-in-law's health, your daughter-in-laws. Your mother-in-law can't talk to daughter-in-law about pregnancy. It's got to be the grandmothers.
Normally when I do see my people in the community, the first thing I do is I look for the body language. If they want to speak to me, I know I can approach them straight up. But if their body language telling me, they don't want to see me, they don't want to speak to me, I just walk straight by, I just say hi,
But I always give them that option, and I've been surprised actually, because some friends and family, they're like, no, you're right, like it's fine, I'll see you. And yeah, so it's good that happens, because they know there's, that confidentiality, and it is just strictly work, and it won't go out of that.
Once people respect you as a community person in the community, they're more likely to come to you. It's going to be easier. Like I get a lot of young fellas that come to me when they've been drinking and stuff, so then they talk to me about it, like, I got this wrong with me, bro, I got this, you know, I need to come and see you about this. I'm like, well, you know where I work, you know, come and see me, come, you know, there's nothing wrong with that.
My work doesn't switch off, it still continues. I still deal with things after hours. You know, I try and have a coffee on the weekend, I still deal with these people. I still have to talk to them after hours, so it doesn't switch off.
And it gives me good confidence, you know, talking to these young girls. And then sometimes I see my extended families and I'm talking again. It's 24-hour work for me, you know.
The Aboriginal health workers would bring more skills around local cultural context and language, and I think that's what's missing. And so if we can strengthen local cultural context and language around sexual health, then it's being delivered in a way where people understand. I think that's the way to go.
And I don't mean just Aboriginal health practitioners, I mean Yolngu nurses, we need Yolngu doctors. This is the missing link. So if it's in Yolngu, if Yolngu's in charge, there's ownership in the people. People have faith and they come to the clinic more. That's the only way.
But this crew is doing a good job. In our health service, like you said, we get young board members, bringing them through the ropes, teaching them everything, governance, how to make sure that in the future that they're going to step up and look after this community, the health service, because the community, the health service, you know, the community is bigger than just the health service.
I think that nursing often takes a lead role, and health practitioners are working alongside the nurses, but I'd really love to see that flip, because I know from health practitioners that I've worked with in the past and the training that I've done with them that they're extremely highly trained and ultra valuable members of those health teams. And so really encouraging and empowering the health workers to step up and be confident to step up and start offering screening to their community is absolutely the way to go.
You know, we've got to work together to move forward. That's the only way to work. We can't do this on our own, you know, we need two parties, Yolngu and Balanda, to work together.
As Aboriginal people, we're like the minority in most of our communities and in Australia, but in order for us to overcome our issues, we sort of have to have the non-Aboriginal people working with us. The difference is that if they're working on our terms more so than us working on their terms. And this is where us owning our knowledge, telling our own stories, and sort of rewriting the policies that fits our cultural appropriateness, I think that's where the change will happen.